Hello, my name's Easton. I'm going to be your nurse for the day. Can I get your name and date of birth?
Yes, Nina Gardner, August 14, 2003.
Gotcha. And do you know why you're here today?
No, I'm assuming it's my annual checkup, review of labs and stuff, but...
Yeah, I also just wanted to review some education material on diabetes, which is a condition that you have, and according to some of the labs, as you mentioned, the condition isn't being managed quite like we'd like. So can you tell me first what you know about diabetes?
I'm pretty sure it's the result of, like, not really watching your diet and not eating too well, but I don't know much about it.
Yeah, those are some factors that can contribute to it. How much of your diet do you watch, or how much do you exercise?
I don't really exercise a whole lot. I don't really watch my diet. I kind of just eat what's available to me. I'm not really good at cooking, and it's difficult for me to manage those things in my current lifestyle.
Why is that? What is preventing you from doing those things?
I just feel like I don't have a lot of time and energy when I get home from work. So it's difficult.
Have you ever thought about meal prepping, or like maybe working out in the mornings before work?
I haven't really considered those things, no. Would they be good for managing my condition?
They help you kind of get ahead of some of the barriers that you mentioned about time and just not having the energy to do things, because you get it out of the way. For example, meal prepping you can do early in the week. You can set up some healthy meals for you, versus working out you can do in the beginning of the day where you have all your energy. Does that sound like something that we could try in the future?
I could try that out, yeah.
Gotcha. But I really want to focus and hone in on what about type 2 diabetes, what you know about it. What is your understanding of the condition again? Can you just...
I don't really know a lot about it, but I remember it being something about, like, blood sugar or something.
Yes, it's pretty much, that's what it comes down to. You want to have normal blood sugar levels. Sometimes with diabetics, they can get too high. That's because the signaling molecule, sorry for my jargon, it's just pretty much a code that your body is like, sends out that's like, we can't store the amount of food that we're taking in, so it just stacks up in the blood. Kind of like this photo here. See, you have high blood sugar, which means hyperglycemia, versus normal. Why is this? It's just kind of because your cells become numb to the little code or signal that gets sent out from your pancreas. Do you have any questions on how have you been monitoring? Let me ask you, have you been monitoring your blood sugar levels?
Well, I haven't really been monitoring my blood sugar levels or taking my medications that I probably should as consistently.
Gotcha. We need to get on that and probably start taking our medications on time. What is preventing you from doing so?
I just forget. I don't know, again, like I said, I feel like I don't have a lot of time and I just things slip away from me.
Okay. Can we set up an alarm to maybe like take our medications?
Yes, I could start that.
Would that be a good? All right, perfect. Maybe a pill binder or something like that.
I like binders.
I'm glad you like binders. But you do need to regularly check your blood glucose levels. Do you have something that would check your blood glucose levels at home?
Somewhere deep in a cabinet.
Good.
Yeah.
Okay. All right. So can we check those maybe before every meal and try to remember to do that? Because it's really important that we do that.
Should I check them after meals too?
Yes, you should. Before, after, maybe sometimes even at bedtime, you should check your blood sugar, and then take the dose of insulin that is prescribed to you accordingly. Does that sound like a good idea?
I could probably do that.
Perfect. Do you have any issues with taking your insulin? Do you know how to take your insulin?
Yes.
Can you just tell me how you take your insulin?
I just put it, I stick it in me when I need it.
Gotcha. We want to like fight before usually.
Oh.
Yeah. And
I don't clean myself there though.
You need to clean the area first, because it can help prevent infection. And how much are you administering?
I just kind of eyeball it.
You should definitely go off what's ordered. There's a sliding scale usually that your doctor will give you that says you can get this amount of units, which is just the amount of insulin, for this amount of blood sugar. So you can take your blood sugar first. That's why it's so important to take your blood sugar, so you can get the correct insulin dose. So we don't want to overshoot and then have no blood sugar. We need like a
I've
a
heard that's
baseline level in the bloodstream.
This makes sense.
Another thing that we need to do when taking insulin is to rotate sites each time. So we can't just shoot it in the same spot every single time. And after you're done injecting, we need to place insulin needles in sharp containers and never reuse. Can you tell me why you think taking insulin is important?
To help manage the blood sugar, because you said it was like the signaling thing for blood sugar to get in my cells, right?
Yeah. It's just gonna help lower your blood sugar, keep it under control. Kind of like a bowl. It's just gonna help you like kind of keep that under control. It's gonna help prevent damage and reduce complications. Do you have any idea what the damage or complications are if you don't manage your blood sugar?
No, I mean, I've heard they're kind of bad, but I mean, my doctor warns me, but
it can cause damage to your blood vessels, cause damage to your eyes, so you can start to lose your sight. You can start to have foot ulcers and eventually lose feeling on your feet and extremities, such as your hands. So like, you'll just feel like a numbness. You ever get like really cold in the wintertime and like you don't feel anything on your fingers? That happens to me a lot. It's gonna be kind of a permanent state of that, where you lose kind of your senses.
that sounds uncomfortable.
Yeah, that's why we really want to maintain and control our insulin levels. Does that make sense?
Yes.
When should you call your healthcare provider? When do you think would be a good time to call?
I don't know. I feel like I don't really know the guidelines for that.
Basically, if you can't control your insulin on your own, let's say your blood sugar is way too high or it's way too low, like you get a reading that's like very not your baseline, what's normal.
What would those be?
Usually under 60, or let's say over, I'd say 250 or 300. It really just depends on what your provider's ordered. I can't speak for that entirely. Or if you have worsening numbness in your feet or sores that don't heal.
Okay.
Or any other symptoms that were described from my symptoms that I listed earlier of what could go wrong. Do you have any questions for me?
I don't think so. I think you did a good job.
Gotcha. Can you teach me back what I taught you, just in a brief little summary about what you're going to do? And you can keep this little pamphlet here.
I'm gonna start setting alarms so I can take the medications on time.
Setting alarms.
Setting alarms.
Setting alarms, gotcha.
And meal prepping so I can make healthier choices for myself.
To
and
address
working
some
out
of
in the morning.
those barriers that you have. You don't have any other barriers, do you?
Just like time, and time is hard. I'm going to start looking at what my doctor orders for my insulin and injecting that based on the readings I get from my machine to test my blood sugar, which is deep in my cabinet right now. And I'm gonna watch out for the signs that you said. Yeah.
All right. Sounds like a good idea. Basically, if this was a patient in another population, such as someone who doesn't speak English, I would get a translator and I would speak directly towards them, not at the translator. If they had even lower health literacy than this, I would try and get maybe a pamphlet and less than a 4th to 5th grade reading level, maybe like a 2nd grade reading level, where I would get something that had more pictures on it. My health literacy things that were barriers to my patient included time and just not knowing what to do. I think I addressed these barriers. Other barriers could include stigma, I guess, to not wanting to be known as a diabetic. I would try and destigmify the issue. Again, if it was another culture that was maybe against medicine, I would try and come to a compromise and where we could kind of have some cohesion. And yeah, that's my video.